Hello, friends. It's Carla, your online doctor, with today's Live in 5. Today is Tuesday, July 21st at 5 p.m. Okay, clinicians and researchers have focused on the acute phase of COVID-19 infection, but it's increasingly clear that some recovered patients need monitoring for long-lasting effects. A study recently published in the Journal of the American Medical Association out of Rome, Italy, reported 87.4% of 143 previously hospitalized patients, remember hospitalized, had at least one persistent symptom 2 months or longer after initial onset of their symptoms and at more than 1 month after discharge from the hospital. Now, understand again, all of these patients required hospitalization, so clearly in the category of much more severe infection. Okay, so I've yet to find any study of people who were stay at home and recover kind of people who have had significant effects. That said, I do have a couple of friends, and one of them said on the tennis court she was feeling a little tired, but yet she was playing tennis. So just put that in perspective, right? Okay, so remember, the large majority of people who test positive can stay home and recover, and some may never have symptoms at all. Now, back to those 143 patients, none had any symptoms of acute infection such as fever or cough, but over 50% still had fatigue, 40% still had shortness of breath, and over 20% had joint or chest pains. Now, the mean age of the group of these 143 patients was 56 and a half, with 37% of them being women and 63% of them being men. Now, only 5% of that group were actually on a ventilator, but almost 75% did have pneumonia diagnosed by chest x-ray. So again, a significant illness enough to develop pneumonia. Now, here in the United States, doctors are having to address the reality that for some, the road to recovery can be very long and steep on occasion. Now, the persistent symptoms do seem to be worse than influenza, people recovering from influenza, especially in those with a severe hospital course. Now, some of the long-term issues described include shortness of breath, some requiring supplemental oxygen. Again, these were in hospitalized patients, poor concentration, blood clots, GI distress, and reduced muscle strength. The long-term pulmonary effects remain unclear to this point and will vary based on the degree of scarring that people are developing in their lungs from the inflammatory response of this virus. Now, Mount Sinai in Manhattan has a program called Mount Sinai Health System Center for Post-COVID Care. They provide specialized interdisciplinary management, meaning if you have interdisciplinary, meaning pulmonologist, gastroenterologist, neurologist, whatever specialty of care you need. So multiple doctors that are going to help you, not just any doctor. And that may include having CAT scans, endoscopy, and even respiratory or anticoagulant medications for a period of time. They also offer training to combat fatigue and deconditioning caused by the overall illness. Now, Mount Sinai is reporting that patients do get better, but may still require monitoring even after 1 full year. Now, it's okay for them to say that considering it hasn't been a full year yet. Again, if we're talking about Mount Sinai in Manhattan, the earliest patients that they were really receiving is March. So March, April, May, June, we're in month 5. I'm not saying that they're going to be wrong, that it could be a year. It may very well be. We don't know much about this virus and we don't know its long-lasting effects, but clearly somebody who's had a severe infection requiring hospitalization, requiring being on a ventilator, requiring intensive therapy of sorts, it's going to be a long road. For the rest of you, for the rest of us who may succumb to getting infected but are staying at home, Hopefully that course is much shorter and much easier. If you are recovering from COVID-19 or know somebody who is, post in the comments. Let us know how you're doing, what your level of energy is. I know of my girlfriend's father, who's in his 80s, was already after, I think it was close, maybe a week and a half, maybe closer to 2 weeks into his infection, was already back to his exercise. Now, he may not be full out doing his normal exercise, but that's an older gentleman who, he stayed at home. He didn't go to the hospital, so he may not be 100%, but kudos to him for getting back out there and doing his thing. And kudos to my friend who's playing tennis. She may not feel like she's at her best, but sometimes the best thing to do is to just get out there and get back to life if you can. I mean, clearly, if you can, do it. So again, post in the comments if you know anybody and what their long-term effects are and if they were hospitalized and such, so we can all learn from each other and maybe get an idea of how this course may go for other people. Anyway, on that note, hope you guys are having an awesome day. I will see you again tomorrow for another Live in 5.